this zone. So to have, I always like to touch and to see like in which direction I pull and how much I have the most effect. So I would do one for the nasolabial fold. Okay. And then one for the marionette line. It's also not so pronounced, but it will help him also with all the jawline. Then in the jaw, to push a little bit the neck down to see the most of it, to have one marking point here. Then the lateral jawline is also very important, that sometimes we don't see so much sagging. In his case we see quite a little bit, but in some cases you will see that they have all of this zone very flat. So sometimes it's not an issue of sagging skin, but if we touch this vector we can see that it's happening quite a lot also in the neck. So this is what we want to do here. We want to get the maximum out of the neck, even though I already said like it's a little bit partly it's some fat and partly it's some sagging of the skin. He's not wearing a beard normally, no?
Wearing what?
Wearing a beard
No.
in the zone. What do you think about the zigzag direct neck lift here in his case?
He's
actually a good candidate for it because it's only medial, right?
Yeah, sure.
Yeah. Okay, but let's have one for the neck done and see how much we can do non-surgically, okay? So I mark another point here, and I would come from here and lift from the pretragus area and see how much we can lift with this, okay? So now the entry points. We start, we have a couple of target points which are in the lateral canthus of the eye, a little bit upper, a little bit more down. Those are the upper points which I would connect first of all with the vertical vectors. So to have one for the medial jawline, one for the lateral jawline, always to prove like this is a good vector, this is a good vector, okay? Then for the nasolabial fold, it's normally we see more effect coming a little bit from up rather than coming from the pretragus area. So if it's too horizontal, we don't have so much effect of it. It's actually a mid-face point. So when we do mid-face face liftings, we also improve from here, right? So this one I connect to this one. We can do it sometimes a little bit curved to re-establish a little bit the volume here, especially in women. It's nice to have this pushing effect and increase the volume over here. And of course we don't want to cross through any edema, and sometimes patients have already fill here. Also he has a quite prominent zygomatic arch, so we would go a little bit under it. Okay, then the one for the marionette line. Also we see that a little bit horizontal, but coming a little bit from top vector also would be better in his case. So we will have one over here. And then for the neck, we'll place it here and we will cross over the mandibular line. There's one trick how to make it easier when he will put the chin to the chest, that all of this vector will be free and easier to go through the subcutaneous tissue, not touching the bone or not ending up too superficial. Okay, we'll do the same design on the other side. What I like to do is not just copy everything from one to the other side, because we always can have some asymmetry. So I like to adjust to whatever I find here. A little bit down. Yes. So I have one over here. Here it's a little bit less here. There's quite a different volumes here in both zones, huh? Okay, and the neck, one more. That's a good vector. This is a good vector. This is one more. And then the reinsertion I wouldn't mark because it would give me too much of a headache to have too much lines here. But we always have to consider the 30 degrees. So for example, for the nasolabial fold, of course we would reinsert 30 degrees down, because otherwise we go
And
into
each
structures.
line you will do it double?
Yes, each line is a V shape.
Yeah.
So here, for example, it would be, the reinsertion would be until here.
Yeah.
For this one,
Yeah.
for this one, I like to place it a little bit down and then along the jawline. So I do like a, because the second one is only for fixation. We can do it like this as well, but with this we have a little bit more of contouring over the time as we have this collagen production. Here as well, like we can go down here 30 degrees, but it will be too painful and probably also too visible in a thin skin to have the 30 degrees placed here down. So probably we also go a little bit down and we make a little bit the reinsertion along the jawline. And with this one as well, like if we do 30 degrees here, it might overlap with the other one, which is not an issue, but especially in the zone, sometimes the skin is very thin. So here we can choose 30 degrees to go on top of it. So like this, we also can cover more of this zone with scaffolding system like this. We have more collagen induction there. Okay. All right, you can go down, you can lay down.
Stop.